Gustilo and Anderson classification for the open fracture. So this involves the type 1. In type 1, the wound is less than 1 centimeter. The level of contamination is and the soft tissue injury is minimal, and the bone injury, if you see, it is simple as well as minimal comminution. Next, looking at type 2. Type 2 involves greater than 1 centimeter of the wound. Level of contamination is moderate, and the soft tissue injury, it is also moderate, and they can include certain muscle damage as well. And looking at the bone, there is moderate comminution. Next, looking at type 3. Type 3, there are 3 subdivisions: 3A, 3B and 3C. Now looking at 3A. 3A involves usually greater than 10 centimeters, and the level of contamination is high, and the soft tissue injury is present and it is involved with crushing. And looking at the bone injury, it is usually contaminated and there's presence of soft tissue as well as there is coverage of the bone possible. Soft tissue coverage is present. Next, looking at 3B. In terms of 3B, it is usually greater than 10 centimeters. The level of contamination is high and there is severe loss of cover of the soft tissue. And in case of the bone injury, in terms of the bone injury, there is the bone cover is poor and it usually requires a soft tissue as well as there is the reconstructive surgery. Next, looking at the 3C. In case of 3C, what is seen is it is usually greater than 10 centimeters. Level of contamination is high, and looking at the soft tissue injury, it involves a very severe loss and it can involve the vascular injury as well, and it requires repair as well. Now looking at the bone cover is usually poor and requires soft tissue reconstruction.